ሰላም ዛሬ እኔና ዶክተር ቤቴል ከዶክተር ቤርሳቤህ ካሳይ ጋር እንገኛለን። ዶክተር ቤርሳቤህ ሐኪም ናት። እንደገና ደግሞ የ2021 ማንዴላ ዋሽንግተን ፌሎ እንዲሁም የ2021-22 ቺቭኒንግ ስኮላር ናት። አይ ቲንክ ራስሽን ልታስተዋውቂ አሁን እድል ልስጥሽ።
እንዴት ናችሁ? ቤርሳቤህ መካሻ ካሳይ እባላለሁ። ሱራፌ እንዳለው በሙያዬ ሐኪም ነኝ። ጠቅላላ ሐኪም። አሁን ከረንትሊ የሚገኘው ለንደን ነው። ለንደን ስኩል ኦፍ ሃይጂን ኤንድ ትሮፒካል ሜዲሲን የሚባለው ስኩል ውስጥ ኤምኤስሲ ኢን ሴክሹዋል ኤንድ ሪፕሮዳክቲቭ ሄልት ሪሰርች እያጠናሁ እገኛለሁ። ማንዴላ ዋሽንግተን ፌሎ የ2021 cohort abal neng. And I've been implementing a project called She Matters, Sexual Health Education Matters, in the Gen Sragod area host, Sisarana Bera, or no emu, the incidence of early marriage in Mekanna Sono. But the guy selected topics of reproductive health in high school Tamarioch, Mastamar Live, focus at a project in a better.
የመጀመሪያ ጥያቄ የሚሆነው አሁን የነገርሽን ሺ ማተርስ የሚል ፕሮጀክት ኢምፕሊመንት እንዳደረግሽ ነው እና ብዙ ጁኒየር ፊዚሽኖች አሁን የተለያየ ፕሮጀክት የራሳቸውን ይዘው ማስኬድ ይፈልጋሉ። እንዳንቺ አይነት ተመሳሳይ ሊሆን ይችላል ገጠር አካባቢ ወይም ደግሞ እዚሁ ከተማ ውስጥ ነው ኢኖቬቲቭ የሆነ ክሪኤቲቭ የሆነ ፕሮጀክቶች እያመጡ ነው። ላይክ ኢንተርፕረነር ማይንድሴት ይዘው እየቀጠሉ ነው እና ግን as a medical doctor ግን project management is a bit new. So launch እንዴት ነበር ኤክስፒሪየንሱ? like what I think ብዙ graduate አድርገሽ አልቆየሽም ፕሮጀክቱን ስትጀምሪና እንዴት ነበር project management experiences? ከብዶሽ ነበረ? what did you learn from it?
So while I was in medical school, similar የሆነ project እንሰራ ነበረ sexual health education for better awareness የሚባል project. Ethiopian Medical Students Association, Denmark ከሚገኝ ተመሳሳይ organization like IMCC የሚባል organization ነበርና አንድ ላይ in partnership ነበር የምንሰራውና እዛ ፕሮጀክት ውስጥ የአዲስ አበባ ቻፕተር ፕሮጀክት coordinator ነበርኩኝ. So I got a little bit of an experience of how to run a project, mostly how to delegate tasks to the youth models, training ያደርጉልን ቁጭ ብሎ training curriculum design ማድረግ meeting organize ማድረግ. So I had a little bit of experience ሺባ ላይ ስሰራ። ከዛ በኋላ ግን I was part of Rise Up Youth Champions Initiative የሚባል program. ያንን program for 8 days in San Francisco ሄጄ workshop የወሰድኩትና እዛ ፕሮግራም ላይ ነበረ በደንብ ፕሮጀክት ፕሮፖዛል ራይቲንግ ፍትፍት አድርገን ወርክሾፕ የወሰድ ነው። ፕሮጀክት ማኔጅመንት ማለት እንግዲህ that was my highest experience of learning how to like devise a proposal and get to implement it. How would I work on monitoring and evaluation section እና እነሱን ነገሮች on that 8 weeks workshop ነበር የወሰድኩት። and luckily ከተመለስኩኝ በኋላ ከዛ ወርክሾፕ አፕላይ ያደረኩትኝ for grant ለነሱ ነው። ያው ኮምፒቲቲቭ ነበረ። የተወሰናችን ጥሩ ፕሮጀክት ፕሮፖዛል ጻፍን፣ ፊድባክም ሰጥተው ነበረ። ከዛ I won the project ማለት ነው። ከዛ ግን implementing it was a lot different than the experience that I've had before while I was an artist, and at the same time than the theories that we've learned in the workshops, because it's a different story when you're actually on the ground. Yeah, and different setup in a better, different context in a better, different people match out. So I had to struggle quite a bit and learn a new way, perhaps contextualized your own way of trying to implement the project in East Coast Amhara region. So there was that experience, and so I learned how to engage madrag and delegate madrag ያለብኝ. Most of the time delegate ማላረግባቸው situations ነበሩ እኔ ራሴ በጣም ምደግምባቸው. Yeah, there were a lot of near tear moments.
በጣም ይገርማል። like ለዚህ ምስራቅ ጎጃም ለነበረሽ ስራና ኤንጌጅመንት ተማሪ ያለሽ የነበረሽ ይሄ ኤክስትራ ከሪኩለር የምንላቸው ኤንጌጅመንት ውስጥ የኤምሳም ሊሆን ይችላል ከዛም ውጪ እና ብዙ በጣም አክቲቭ ነበርሽ። ከኔ ኤክስፒሪየንስ ጋር ኮንትራስት አደረገው በጣም ይለያያል። ምክንያቱም ተመርቄ እውነተኛው ዓለም ውስጥ መስራት ስጀምር ነው ፕሮጀክት መጻፍ፣ ማኔጅ ማድረግ፣ ኮሚኒቲ ኤንጌጅመንት የሚባሉ ሀሳቦች የመጡት እና አንቺ ተማሪ ያለሽ እንዴት ራስሽን ወደዛ ማስጠጋት ቻልሽ እና እነዛን ልምዶችን መቅሰም ቻልሽ?
I think ከሃይ ስኩል ጀምሮ ይሄ ቮለንቲሪንግ ኔቸር ነበረ። ሃይ ስኩል 11ኛ ክፍል 12ኛ ክፍል SOS ችልድረን ሄደን እናስተምር ነበረ። ከዛ ሌላም YWCA I used to volunteer to teach, so I was looking for such an experience when I got into medical school, and MSA seemed like a good platform expand ማድረግ ላይ ማለት ነው። So የዛኔ engage ካደረኩኝ በኋላ ነው I think that I learned about public health, community health, and there's a bit more as a student that I could have done to help and improve upon community health, not just medical school career. And I guess it could get a bit frustrating medical school ውስጥ ቁጭ ብሎ በየቀኑ consumed መሆን እዛ reading ውስጥ እዛ clinical practice ውስጥ. So that was my platform. Like I was happy to go there to engage with other students and ያሉ ፕሮጀክቶች ላይ ያሉ ካምፔኖች ላይ ያሉ አውትሪቾች ላይ volunteer ማድረግ was sort of a release for me because I liked it. So እዛ ላይ attend አደረግ ነበረ. So I think high school ጀምሮ የመጣ ነገር መሰለኝ ይሄ volunteer ማድረጉ. So I looked for like what could I do, and then there's MSA የሚባል ነገር አለ። ስለዚህ let me volunteer there, and then while volunteering there I got to see like ትንንሽ ነገሮች እናደርጋቸው የነበሩ. There was a project called Gleamer, not sure if you know it. ሩት ነበረች የምትሰራው like I think 3rd year or 2nd year ነበርኩኝ። ከዛ ኦርፋኔጅ ላይ ሄዶ ፍሪ ሄልት ኬር ሰርቪስ መስጠት ነበረ። I think ሙዳይ ነበር የሚባለው መሰለኝ if I am not mistaken. And then በቃ በጣም ብዙ ሰዎች ይመጣሉ፣ ብዙ ህፃናት ይመጣሉ፣ ቤተሰቦቻቸው ይመጣሉ። ግሩፕ ሰርተን እናስተምራቸዋለን on like basic hand washing, እንዴት ማድረግ አለባቸው። ከዛ የተለያየ ዊንግ አለ፣ ሐኪሞች የሆነ ዊንግ ላይ ቁጭ ብለው ዳያግኖስ ያደርጋሉ። ከዛ ዲስፐንስ የሚያደርጉ like pharmacy ዊንግ ነበር እንዳለ all constructed ማለት ነው. I guess that got me to see the impact that I could have in a community health, which could be low but would have a higher impact. And then through that I continued to like build my capacity, because that was also one of the aims of MSA, like building the capacity of the students and help them be more than like medical students. So I guess I grew professionally through MSA, and that's how I developed interest for community and public health.
Yeah, በጣም እድለኛ ነሽ ብዬ አስባለሁ። like ብዙዎቻችን ተመርቀን ሄደን በራሳችን ሌላ ተጨማሪ ኤፈርት እንደሚጠበቅብን ስናውቀው ነገሮችን ፕሮጀክታይዝ ወደ ማድረግ እና ወደ ኮሚኒቲ ኤንጌጅመንት ምናምን የምንገባውና which was the case for me ከኔ ፐርሰናል ኤክስፒሪየንስ እንደገና ብዙ ነገሮችን መማር ነበረብኝ። አንቺ ከሁለተኛ ዓመት ጀምሮ የምታውቂያቸው ነገሮች እና ምናልባት እነዛን እድሎች ወይም ልምዶች ላልነበረው ሰው እና አሁን ሐኪም የሆነ ሰው፣ ምክንያቱም ጎጃም ብቻ መሆን የለበትም አዲስ አበባም እነዚህ ነገሮች ስኪሎች ይጠቅማሉ እና ከየት ነው ይሄ ሰው የሚጀምረው? በጣም ኦቨርዌልሚንግ ይመስላል እነዚህ ነገሮች ሲባል ነው። ከየት ብንጀምር ይሻላል ብለሽ ታስቢያለሽ?
I think you're asking me already graduate አድርጎ መርዳት like ማገዝ የሚፈልገው ሐኪም ነው መሰለኝ። I guess it's seeing the problem around you bits by bits and then trying to contribute your fair share. ትንሽ ሊሆን ይችላል። like እኔ ወደ ደጀን ሲሄድ ወደ ገጠር like መደብ ራሱ ነበር የምፈልገው። I want to go there, and the areas that I want to work on are like reproductive health, life family planning ላይ በቃ like ማገዝ ፈልጋለሁ አይነት ነገር ነበርና before even applying for the project, like I used to engage in conversations like with the women there, like hard conversation ለምን ግን የሆነ contraceptives, why wouldn't you take it? And what are the challenges of doing that? And getting to implement the project as well. Like I used to gather women, ጎረቤት ምናምን ማቃቸውን over coffee and then challenge their thinking. I used to do that. And then I even went to like the high school, say engage አደርግ ነበረ, like what's their knowledge ምናምን እያልኩኝ እና before even the project, that was what I wanted to do. Reproductive health area ላይ መስራት ፈልግ ነበረ. ከዛ እዛ ስሄድ particularly early marriage could be something that I could tackle የሚለውን ነገር አየሁኝ። ከዛ luckily there was a call for a project, so I applied for that. ትንሽ ሊሆን ይችላል ኢምፓክት ትንሽዬ ነገር የሆነ አንድ ነገር ቲቺንግ ኦርጋናይዝ አድርጎ ሄዶ የሆነ ማስተማር ፓሽኔት የሆንክበት ኤሪያ ላይ ከዛ ደግሞ ጋፕ ያለበት ኤሪያ ላይ ምን ማድረግ እችላለሁ ብሎ ራሳችንን መጠየቅ መሰለኝ the first step, like what could I do in my capacity and the little knowledge that I know, like what do I know better that I could impart in the community, and what way can I help, like የሚለውን ነገር ማሰብና starting from that, like from small ይመስለኛል, because it could not be that all our passions are into going into projects. There could be like a lot of us who would want to do residency and not go towards this line. So I think it's better just to ask yourself, like what could you do, like for a moment there. And you might not have like a really long time to actually implement a project. I guess that's the basic question that we could all ask ourselves.
ይሄ ልምድ ነበረሽ፣ ይሄ ስኪል ሴት ነበረሽ ኦልሬዲ ጎጃም ስቴጂ ደጀን ስቴጂ ግን ማድረግ የምትፈልጊውም ደግሞ ታውቂ ነበር, which is sexual እና reproductive health ላይ መስራት እንደምትፈልጊ ግን የገጠመሽ ነገር ቀጥታ ዳይሬክትሊ ትራንስሌት ማድረግ ሳይሆን ለዛ ቦታ ኮንቴክስቹዋላይዝ ማድረግ ነበረብሽ ስራውና ኮሚኒቲ ኢንጌጅመንቱን እና በዛ ፕሮሰስ የተማርሻቸው ነገሮች ምንድን ናቸው? እንዴት ነው ኮንትራስቱ? እንዴት ነው ከአንቺ ኤክስፔክቴሽን እና ከሪያሊቲ?
Whenever we want to do something or implement a project or design a program, it's very important to understand the context of that society. It could be very well different than one that we are used to. So that's what I tried to do መጀመሪያ ላይ እንደዛ ነው ማድረግ የሞከርኩትኝ. So like I told you, like sexual reproductive health workshop ሄጄ ወሰድኩኝ. Because I'm like, oh, I could do this, like I'm be excited for me to like to even like conceive the project idea, like to have a conversation about it with people, it was so challenging. I also had to find an organization because there's an organization like so I had to find organizations like ደብረ ማርቆስ ሄድ ነበረ, like ቤተሰብ መምሪያ ጋር ባካችሁ እንደዚህ ምስራ, because like it's very convoluted and complicated, እንዴት አድርጎ ገንዘቡን ቻነል ማድረግ ይቻላል ምናምን. ስለዚህ like I looked for other organizations ምናምን, so it was a bit of a challenge itself. So I actually got to, I won the grant, so it started like project implementation ላይ ደግሞ ደረስን. because የዛኔ ራሱ was a different like context. እኔ high school ተማሪዎች አዲስ አበባ ያሉ ልጆች ጋር ነው that I'm used to, so ያኛውን approach ነበር ይዤ ሄድኩትኝ. so ሁለት አይነት different አለው, like sometimes it could make your job easy, sometimes it could make your, like it's just contextualized ነገር ነው. The good part about the high school students that I worked with were በጣም ስነስርዓት ያላቸው ናቸው, ጨዋ ናቸው, like perceptive ናቸው, ይሰሙሃል, በጣም punctual ነበሩ. So that was a good thing, because that also needs to be mentioned, you know. But when it comes to the society, like sexual and reproductive health, I'm about to teach ሲባል እሰራበት የነበረው hospital, like there was somehow supportive የሆነ ነገር አለው, ግን they wouldn't be that excited about it. And even like with some of the high school administrator staffs, mostly they'd be supportive about it, and they would have a different idea of what early marriage should look like. So a girl drops out from my classes, and then I think she's 22 or something, and high school can late age line in Heath. So like when I engage in a conversation with one of the teachers, he's like, "Some agabachko manam." Not agabach, manam isn't she a bit too young? And then after I said, "Tinshi no jimada galabacho." መቆየትም አይለባቸውም ከዛ በኋላማ እሱ መጥፎ ነው ዶክተር ምናምን ይለኛል እና understand the context. So yes, early marriage and they want to prevent it, but at the same time, women are supposed to go to marriage, so እንዳያጡ ባሎችም እንዳያጡ, and that's the right thing to do. So like you had to align and contextualize what you were saying, like yes, you're supposed to challenge it, but at the same time also like fuse into the community and understand what they're saying and understand where their worry is coming from, you know, like most of the parents and a society in the bad thing in the bad thing to know like marriage and adoption and marriage. So what is that? Because they feel like they're doing some favor to their children by marrying them off, you know. So I think it starts from thinking ለምንድን ነው እንደዚህ የሚያደርጉት የሚለው perception instead of like ምን አይነት horrible people ናችሁ እናንተ እንዴት ነው ልጆቻችሁን ሳይሆን they think they're doing their children a favor. So like I had to construe like የሆነ ከjudgmental አዲስ አበባ ሆነን የሆነ harmful traditional practice happen ሲያደርጉ በጣም መጥፎ ነው እንዴት አይነት opinion ሊኖረን ይችላል ከዛ ሄጄ ግን I had to like actually sit down and like understand the perspective of the parents, like why do they want to do this, you know. And they're not necessarily a horrible people and the society is not necessarily horrible by committing this bits and bits of like harmful traditional practices, but like understanding and also like fitting in. I think it was a bit hard for me given my background and going also from a point of privilege, which could be misunderstood as a so I had to fit in. My language had been refined, but Bamarinyan understand Atriko as a Kababi, Ongwa, and a dialect, like communicate matrag, understanding that to understanding that masa work my let's know. And is not possible like we're doing now because this is quite informal. So like I had to unlearn some of the things and learn some of the things and like align my thought process with the Mahabarasep's expectation and with the society's way of living.
ሶስት ነገሮችን አወጣውን ማለት የመጀመሪያው ነገር is identifying the positives that exist already in that place. በጣም የሚገርም ነው እሱ ምክንያቱም ለመጀመሪያ ጊዜ ነው ሰው ገጠር ሄጄ እንዴት ፐንክቹዋል እንደሆኑ ተረዳው ሲል የሰማሁት ማለት ሳስበው ልክ ነሽ እንደዛ ነው የተማሪዎቹ መገኘት መታዘዝ መቻል እና ያን እንደ አንቺ መጠቀሚያ መውሰድ መቻልሽ በጣም የሚገርም ነው ሁለተኛው ደግሞ it's understanding the context with which they speak about early marriage ያን ኤምፓቲ ማምጣትሽ በጣም ይገርማል ከነሱ ፐርስፔክቲቭ ማየት መቻልሽ በጣም የሚገርመው እንደ ጎጂ ባህል ሳይሆን እንደ ጥሩ ባህል ነው የሚያዩት እና ልጆቻቸውን የበለጠ አድቫንስ እንዲያደርጉ በላይፍ የበለጠ ቻንስ እንዲኖራቸው እያደረጉ ነው እና ሰውን ከዛ መከልከል ሬዚስታንስ ያመጣል እና ያን ማየትሽ በጣም it's interesting. ሌላው ሶስተኛው ደግሞ the idea of fitting in ምክንያቱም privilege can do good for you, it can also keep you from relating to others. And not just what you said about only confining yourself to speaking Amharic, you know, unlike what we're doing now. Yeah, but I'm be listening at the again. So እንዴት ቀጠልሽ ምንድነው ያለ እድሜ ጋብቻን ወይም early marriage ያስተማርሽ ነበረ እና ፕሮጀክቶቹ እንዴት ነበር ኮኔክት ሲያደርጉና ሲሄዱ የነበሩት?
Initially the plan was መጀመሪያ about 200 high school ተማሪዎችን we wanted it to be few focused ሆኖ በደንብ ኳሊቲ የሆነ ነገር እንድንሰጣቸው so የተወሰኑ ተማሪዎችን ትሬን አድርጎ ከዛ to make them an advocate to make them like she matter champions. That was what I used to call them, and then advocate for early marriage inside the school and also among the community by connecting them with health extension workers. So that was the plan from respect of early marriage, but also selected የሆኑ sexual and reproductive health knowledgeዎችንም ማስተማር ነበረ and early marriage session ይኖረዋል ሁሉ ጊዜ workshopዎቻችንም ይኖራል ላይ ከዛ በኋላ ግን በዛው we used to like give them bits and knowledge of like menstrual hygiene management, the other harmful traditional practices, like family planning, gender equality, like women empowerment, STI. So like we had to fuse in some of those things in between. So the workshops went well until COVID-19 pandemic hit. So like all of it had to come into a halt, and then we had to stop and think. There was no way for me to access the high school students ምክንያቱም አብዛኞቹ ከገጠር ቀበሌዎች ነው የሚመጡት ሁሉም ተበትነው ሄደዋል እኔ ጀምሬ ነበር አይ ቲንክ 70 ተማሪዎች አካባቢ ወርክሾፕ ሰጥቼ ነበር ሶ እነሱም ገጠር ሄደዋል like በየቀያቸው ተበትነው ነበር so in order to tackle that again my donor was quite nice and understanding like logical framework approach ድጋሚ መቀየር ነበረብን ምን አርገን እንዴት አርገን እናደርግ እሱንም ያደረግነው ያው ከ6 ከ7 ወር ምናምን በኋላ በደንብ ከገባ በኋላ because everyone was scared of going out of the house ማንም ሰው አይወጣም ነበር including ourselves so ጤና ኤክስቴንሽን ሰራተኞቹን ኢንቮልቭ ማድረግ የምንችልበት መንገድ ካለ let's try to like involve them and link them with the high school students whoever is a volunteer and whoever could so like we organized a workshop for health extension workers on early marriage. I think half a day workshop. We introduced them with the high school students we already were working with, very few, because absanyao sa undale tabettino nebere. Selezi pair adrgen bet lebet hedo early marriage and miastemrubet toolkit azagajenlacho. Eza በየቀበሌያቸው 8 ቀበሌ ነበር ታርጌት ያደረግነው 8 የገጠር ቀበሌዎች በደጀን ወረዳ ስር የተያዙ ስለዚህ ወደ እነዛ 8 ቀበሌዎች የጤና ኤክስቴንሽን ሰራተኞቹ like as much as possible with the she matter champions ሄደው እንዲያስተምሩ ማለት ነው በየገጠር ቀበሌው አድርገው pre እና post questions ይኖራቸዋል ይሄዳሉ they will try to have a conversation with them so there were a lot of challenge ምክንያቱም ወደ እርሻ ምናምን ይወጣሉ ሰዎቹ ቁጭ ብለው አይሰሟቸው ግን anyway እንደዛም ሆኖ ምናምን effectively I think ወደ ፕላናችን የነበረው እያንዳንዱ ቀበሌ ላይ 200 ቤቶችን አድሬስ እንዲያደርጉ ነበር 200 ቤቶችን እንዲያደርጉ ስለዚህ 1600 አካባቢ ማለት ነው ከዛ ግን effectively መጨረሻ ላይ I think they reached out to like 600 700 households and ከዛ ከነሱ ውስጥ ደግሞ like ፔፐሩን በስነ ስርዓት ፕሪንት ፖስት እና ተሞልቶ ያገኘነው ደግሞ 350 ምናምን ቤቶች አካባቢ ነበረ which is still significant so they managed to reach out to እነዚህ ቤቶች and then teach about like early marriage and while actually doing that they also like identified a case of fistula like early marriage experience አድርገው ግን ቤታቸው ተደብቀው የነበሩ ሴቶችን actually like particularly where one who stood out that I never misnoro and we tried our very best in getting her a help and medical care but again there's still much work that needs to be done like teaching about fistula it's preventable it could be fixed you know I mean that was a bit unsuccessful but there were also these stories like when they go door to door ያገኟቸው ሴቶች ነበሩና እነዚህ ነገሮች አስተማሩ so that looks like the span of the project high school line ነበረ ተጀመረው so we had to go out to the community and then incorporate health extension workers incorporate ማድረግ ነበረብን so we worked with the high school students and with the health extension workers to disseminate information on the deleterious effects of early marriage among the community
ያንቺ outreach እና ትምህርት ኢምፓክቱ ምንድን ነበር like what happened after that
with regards to the high school students ያስተማርኳቸውን pre እና post evaluation ነበረ በደንብ ተምረው ሲወጡ እናይ ነበረ and then with the evaluation we could have learned that they've learned better and like we even had to focus mostly on ሌላ ቶፒኮች ላይ sometimes like menstrual hygiene menstrual calendar መቁጠር and like ረዥም ሴሽን ሲወስድብን ትዝ ይለኛል ቁጭ ብለን ስናስረዳቸው so most of the time እንደዚህ እናደርግ ነበርና with regards to like the knowledge about early marriage about the different reproductive health issues የነበራቸው ነገር በደንብ ሲቀየር እናይ ነበረ ተማሪዎቻችን ማለት ነው ከዛ ኮሚኒቲው ላይ የተሰራው ስራ I still have like a data which analyze አድርጌ ፕሪና ፖስቱም ማለት ነው እንዴት ለውጥ ነበረ አልነበረም የሚለውን ነገር assess adrigan like I'm still like trying to write an abstract for it like to present it again overall like there were places whereby like attitudes were improved because of the education that the community have received and the households have received. But still, it was a bit hard because the COVID pandemic had hit and had changed a lot of things. Like early marriage reports in some areas, in some of the qabalis, you know. So yes, I was implementing this project in Waradaula. Hopefully it would trickle down to the different qabalis. But then again, there was a confounding. Like COVID-19 pandemic had hit, ሁሉም ሰው ከትምህርት ቤት ተመልሶ ነበረ። illegally ምናምን የሚዳሩበት situation ነበረ. So COVID had interfered in that and like had made the data like you wouldn't say like በዚህ ዓመት ቀነሰ revert back አድርጎታል some of the things. And there was, at least for me, there was not much that I could have done like to reach out to at least the health extension workers. And there's also the advent of COVID. But like I have that data and some of the attitudes have improved. And there's also that story that I told you about like finding those like fistula patient. And so there's also that significant story. And we had a conversation with her. It's possible and like still I communicate with the health extension worker that's closely working with her. And I hope she'll receive the care soon. So there is a bit of COVID impact but somehow improve knowledge when it comes to early marriage. But for sure, የተማሪዎቹን attitude እና perception እና knowledge በደንብ improve አድርገናል። የማህበረሰቡም በደንብ like with pre and post analysis የሰራነውን አብዛኛውን attitude and knowledge improve አድርገናል. But still, like if you tell me incidence ቀነሰ, I might not be able to say that to you. But then again, there are a lot of other factors.
So የባህሪ ለውጥ ለምሳሌ ለማምጣት በወላጆች ሊሆን ይችላል በልጆቹ ባለሽ ልምድ ከዚህ በኋላ የቱ ጋር ቢሰራ ብለሽ ታስባለሽ? like ባለሽ insight.
I still feel like it's very important to work on like adolescent and youth. እኔ የሰራሁባቸው እንትኖች ላይ አሁን ሄልዝ ኤክስቴንሽን ወርከሮቹ ወጥተው ሲያዩ ሪፖርት ባክ ያደርጉ የነበረው የተወሰነ አሁንማ በቃ ህጉ እኮ እንትን አይልም ግን ልጆቹ ናቸው የሚያስቸግሩን ይሉ ነበረ። there's still that perception ልክ እንዳልኩ ያኛው አስተማሪ እንዳለኝ እንዴ በቃ እኮ ማለት ቶሎ ታግባ እንጂ የሆነ ትንሽ እሺ 18 አድርሰናታል 20 ምናምን ስትደርስ ቶሎ ታግባ ልክ እንዳልኩ ነው። the better option ተብሎ የሚታየው ስል በቶሎ ማግባት ነው። በቶሎ ማግባትና ቤተሰብን ፕራውድ ማድረግ ምናምን እሱም እንዳላለ ይሄ እንግዲህ በማህበረሰባችን ተቀርጾ እያንዳንዱ ሰው ጭንቅላት ውስጥ ኢንግራይንድ የተደረገ ነገር ነው ተማሪዎቹም ላይ ጭምር ማለት ነው። እና I think it's still important for me to still work with adolescents and youth and then continue to empower them with like better alternatives. በደንብ ማሳየት መቻል ነው አይደል? I feel like there's still much that could be done at a community level, at a parents level, like to have a discussion with them. At least እኔ ነበርኩበት አካባቢ በደንብ perceptive ነበሩ። like ቁጭ ብለህ በደንብ lengthy conversation ከውጭ resistant ሊሆን ይችላል ግን በደንብ conversate ስታደርግ የሚል like ገባህ አይደል? So I think we could still work with that, but I don't know, maybe because biased ሊሆን ይችላል because I've been able to see a change in the perception and attitudes of in the adolescents and youth. I feel like there's still hope and potential to still work in that area.
ያቺ aha moment lengthy on a conversation ያስፈልጋታል
በደንብ ያስፈልጋታል። You can't just go like hey this is bad ምናምን ብለህ outreach ነገር አድርገህ ሳይሆን እንዲህ እኮ ነው ገባህ አይደል? ይሄ engagement personal touch having that lengthy conversation. I mean እኛ ራሱ you prefer to like for that like to read in depth and know about things a bit more, yeah, and it couldn't just come from superficial level like campaign ምናምን አይነት ነገር ሳይሆን actually መረዳዳት።
ስለዚህ አሁን የሴክሹዋል እና ሪፕሮዳክቲቭ ሄልዝ ላይ ማስተርስሽን ይሰራል so የሆነ አይነት continuity አለ ከመመረቅሽ በፊት ከተመረቅሽ በኋላ እንደገና ደግሞ አሁን ይሄን ግራጁዌት ስተዲ ስትጨርሺና እንዴት ነው ቤቴል ቅድም የጠየቁት ጥያቄ ነው እንዴት ነው ፕሮሲድ ማድረግ ያስብሽው በዚህ ቪዥን እና በዚህ ሰርቪስ?
So ቅድም ቤት የጠየቀችው ላይ like what's next for She Matters. And then I'll get to your question, what's next for you? If no career path like I have applied She Matters and scale up ማድረግ ልክ እንዳልኩ I feel like there is much more that needs to be done with adolescents and youth በደንብ እዛ ኤሪያ ላይ ብንሰራ በጣም መልካም ነው ብዬ አስባለሁና She Matters and scale up ለማድረግ grant I have just recently won a small grant again to scale up She Matters, but the approach that I plan on following with that is comprehensive sexuality education guidebook, whereby so like early marriage was a thing የዛኔ አሁን ግን broadly በደንብ empower ማድረግ ፈልጋለሁ adolescent and youth, mostly like first year freshman university students like አካባቢ ነው መስራት የምፈልገው እና comprehensive sexuality education guidebook produced ለማድረግ I have just won another round of grant from Rise Up, so I'll start implementing it January ጀምሮ while I'm here, but it's developing a guidebook, so I'll be in continuous communication with people Ethiopia ውስጥ ካሉ ሰዎች ጋር በደንብ communicate እያደረግን I hope to successfully implement that along my educational career, so that's for She Matters. And then I hope to continue the works that we're doing, contextualize እያደረግን በሚያስፈልገው area ላይ SRHR በአጠቃላይ ኒሹ ሆኖ ግን የተለያዩ ነገሮች ላይ የተለያዩ ኤሪያዎች ላይ መስራት የምንችልበት አጋጣሚ ይኖራል and I hope to continue to scale it up for She Matters. For me, like you said, yes, there is a continuity, and I'm glad that I actually joined EMSA. መጀመሪያ ላይ ልክ እንዳልኩ different outreaches ላይ ነበረ volunteer የምናደርገው like የተለያዩ standing committeeዎች አሉ, standing committee of publicans, research and exchange ላይ በደንብ ሰራ ነበር የተለያዩ like research option conduct አድርጌ some of it is which published, and then public health ውስጥ ደግሞ እንገባለን malaria TB ምናምን, so I used to like volunteer in all of those because መጨረሻ ላይ like መጨረሻ ላይ ሳይሆን መሀል አካባቢ ላይ ሺባ ጀመርን project ሺባ. And so my interest continuously kept on growing. And then I found myself being very interested in sexual and reproductive health, which is something that I would advise others to do as well. Like find your niche. Yeah, medicine is very broad, right? And it allows us to expand in different areas. So that's the benefit of it. And like I found that niche. And because once I found it, like I'm committed home when Shiva became my thing. And that was an area that I worked on. Because again, women delivery and by organization better looking at the young leaders interested in sexual and reproductive health and gender equality and women empowerment. So like I joined that cohort one point. I got like digital university training like for a year, advocacy ምናምን SRHR ቅድም mention ማድረግ እችል ነበር actually project implement ለማድረግ ከረዱኝ ነገሮች ውስጥ አንዱ እሱ ነው። ስለዚህ በቃ I narrowed my focus SRHR ሆነ, and then Rise Up came. ገጠር ስሄድ ራሱ in my head SRH ላይ በደንብ መስራት ፈልጋለሁ አንድ ነገር ኮንትሪቢዩት አድርጌ ማምጣት ብችል I'd be proud of myself በሚለው ነበር ደጀን ሄድኩኝ። ከዛ ደብረ ማርቆስም ገባሁ። ከደጀን እየተመላለስኩ ደብረ ማርቆስ ዩኒቨርሲቲ ነበር የምሰራው። ከደጀን በኋላ እየተመላለስኩ ኮምፕሊመንት አደረግኩ ጨረስኩ። Now I'm pursuing a master's in sexual and reproductive health, which I'm quite happy about, በደስታ and I hope to continue along this line. That's my passion. That's my area of interest. I hope to work mostly like in like Ethiopia and Africa, low income countries. At this point, I'd be expected to do a lot of research for my thesis, and that's where I want to focus back home and like expand CTERG in Africa, because I feel like we still have several untapped potential and several problems that need still be addressed. So I want to continue to work there, and then I see myself in the future actively participating and improving SRHR in Ethiopia and in Africa. So that's the area that I want to head towards. It could be whichever organization, or it could be running my own organization, but I just want to continue to improve and work on SRHR.
So አንቺ አሁን ከምትይው it seems to me የራስሽን ኒሽ ካገኘሽ በኋላ ፎከስሽን በዛው ናረው አደረገ። ግን ወደ እንትን ነው ያመራው በጣም ጀነራል ወደሆነ ደግሞ ዳይቨርስ ወደሆነ ኢንጌጅመንት ሞዴል ነው ያመራውና የሆነ የሚታለፍ ታነል ነገር አለ። ይሄ የራስሽን ፓሽን የምታገኝበትና ሰርቪስ ሞዴል የምታገኝበትና ኤንጌጅመንት የምትፈጥሪበትና አይ ቲንክ ለብዙ ሰዎች እንደዛ ነው። ይሄ በጣም ስፔሲፊክ የሆነ ፕሮብለም ሶልቭ ማድረግ ሲጀምሩ ፊውቸሩ ኦፕን አፕ ያደርጋል አላ የሆነ አማራጮችም እንደዛው ሰው በጣም ትልቅ ኢንሳይት ነው። ይሄ አሁን ደግሞ ጋይድ ቡክ መጽሐፍ መጀመሩ ስኬል ማድረግ መቻል እነዚህ በጣም ኤክሳይቲንግ ናቸው። ሰው ሌሎች ኒሾች እንዳሉ እርግጠኛ ነኝ። ላይክ ሜንታል ሄልዝ አለ፣ ብዙ አይነት ፕሮብለም አለ በእኛ ኮሚኒቲ ውስጥ እና ዱ ዩ ቲንክ ትራንስፈረብል የሆኑ ስኪል ሴቶች አሉ ወይ? አንቺ አሁን በአንቺ ካሪር ፓዝ ላይ ያገኘሻቸው አስተሳሰቦች፣ አረዳዶች ሌሎች የራሳቸው ኒሽ ውስጥ ላሉ ሐኪሞች የሚጠቅሙ ነገሮች ማስተላለፍ የምትችው አለ ወይ? አንቺ አሁን ኤስአርኤችአር ላይ የሰራሽ ነው። ሌላ ሰው ለምሳሌ ሜንታል ሄልዝ ላይ የኔ ኒች ያ ነው ብሎ ቢያስብ፣ ሌላ ሰው ደግሞ ነን ኮሚኒኬብል ሃርት ዲዚዝ ወይ ዳያቤቲስ ላይ ነው መስራት የሚፈልገው። ሁሉም ኢኳሊ በጣም ኢምፖርታንት የሆኑ ችግሮች ስለሆኑ እና ግን ትራንስፈረብል መሆን የሚችሉ ብቃቶች አሉ።
Okay. I guess the major thing is that interested የሆንበት area ላይ we need to invest a bit more time on it. And ልክ እንዳልከው ይሄ ናሮ ይሆናል መጀመሪያ ላይ ስፔሲፊክ ኤሪያ እስክታገኘው ድረስ it's a bit wide and then you feel like you're being confined to like MCTs ብቻ ምናምን። ከዛ ግን በደንብ ኤክስፕሎር ስታደርግ በጣም ብዙ ኦፖርቹኒቲዎች አሉ፣ ብዙ areas of intervention አለ፣ ብዙ like areas of research. I mean ልክ እንዳልከው ነው። I'm so happy how you like put it in terms of that. But like in order to expand on it, to know more about it, you need to ትንሽ ኢንትረስትድ የሆንክበት ኤሪያ ላይ ኢንቨስት ማድረግ ነው። ግን ቢፎር ዳት እኔ በደንብ አድቫይዝ የማደርገው ፍሮም ኤርሊ ኦን ፒፕል ኒድ ቱ ኤክስፕሌክት። እኔ ኤምሳውስ ቮለንቲር አድርጌ ብዙ ነገሮችን ካየሁ በኋላ ነው አይ በቃ this is what I want የሚለው ውሳኔ ላይ የወሰንኩት። ስለዚህ ያንን ነገር ለማግኘት because a lot of people still struggle with that እና I think it's very important to put yourself out there, like volunteer, understand ነገሮችን in somewhat an informal setting. አሁን ቁጭ ብዬ እሺ ኤሪያዬን እንዴት ስለፈልግ ምናምን ብዬ ቁጭ ብዬ ባነብ ኤስአርኤች እንዲህ ማለት ነው ይሄኛው part of like medicine እንደዚህ ነው ምናምን ብሎ choose ለማድረግ I think it's a bit difficult still. Like you need to have some form of exposure አይደል? ስለዚህ ምንድነው ማድረግ የምችለው? What does that mean? ያ ኤሪያ የሚለውን ነገር understand ለማድረግ we need to like explore a little bit. We need to give ourselves time to like explore and then find an interest. I mean some people could be lucky ከድሮ ጀምሮ like ይዘውት የሚመጡት ነገር ሊሆን ይችላል። በቃ እኔ ግላውኮማ ላይ ነው መስራት የምፈልገው because I've seen like ከህፃንነት ጀምሮ ያለውን ችግር አይቻለሁ። ስለዚህ that's the area that I want to work on. That's perfect. And a lot of other people don't. So I think it's very important to put yourself out there and experiment and then get to see መጀመሪያ መማሩ መልካም ነው ብዬ አስባለሁ። ከዛ በኋላ ግን once you find that niche, expand on it, like invest in yourself. Find programs that would actually like help you become a better version of yourself in that area. And from my perspective, and that's what I tried to do. Women health or productive health was the area that I wanted to do. So when opportunities came, I took them. Like Women Deliver, my affiliation with an organization called Women Deliver, Rise Up Youth Champions Initiative, all of them work in this stream of SRHR. So that's how I like put myself into it, and it helped me have a focus, honestly. But I'm focused on that. So I expanded upon that, and I was able to build up on that and bring a project to an area that I was working on. So like invest your time into it first in identifying your interest, and then once you identify it, go along that line. Like you look for international and national organizations or institutions that would actually help you become a better version of yourself, and then take trainings on that subject. But I'm busy online. The world is there are a lot of like sessions online, like courses on Coursera for free. Like you need to apply for them and then take them. Luckily, Women Deliver and Digital University na very certificate course. can like apply it to your niche. Na beza area. If you want to be good at something, I think you need to invest your time and energy into it. That's what I would recommend in general.
And I think the courage that it takes is something that we can all learn from. የሚጀምረው ሁሉም ቦታ ነው ከዛ አንድ ኒሽ ታገኛለሽ ከዛ you sacrifice putting time and energy is sacrificing for that passion ከዛ በኋላ ደግሞ it opens up I pick up ማድረግ የምፈልገው ይሄ ግሎባል ነው አሁን ይሄ ነገር like እነዚህ ፕሮጀክቶች እነዚህ ኢኒሺዬቲቮች ብዙ ኢንተርናሽናል እና ግሎባል ኔቸር አላቸው once you start doing something and then communicating to that on an international level it becomes a global thing and now how do you then bring it back home but I'm a diverse set of experiences and knowledge ቅድም ያልሻቸው ኤምፓቲው ምን አለ ግን can we try to institutionalize እነዚህን experiences እና initiatives as in you have your project out ግን ከሎካል ኦርጋናይዜሽን ጋር affiliated ሆኖ መስራት የሚችልበት ሁኔታ አለ ወይ ምክንያቱም we have structures ሎካል ኤሪያዎች ውስጥ የመንግስት ስትራክቸር አለ የሲቪል ሶሳይቲ ስትራክቸር አለ እንደዛ ታስቢያለሽ ኮሚኒቲ ግሩፖች አሉ
so for this particular project and implement ያደረኩትም የሺማተርስ የመጀመሪያው ፌዝ ፕሮጀክት ልክ እንዳልኩ ብቻዬን አልነበረም ከኦርጋናይዜሽን ጋር consortium of youth for development organizations in Ethiopia ኮይዶ የሚባል አለ I'm not sure if you know of the organization it's been helping የተለያዩ NGOs youth and SRH are focused on education like capacity build ማድረግ ላይ ነበር focused የሆነው anyway ከኮይዶ ጋር ነው ሺማተርስን ኢምፕሊመንት ያደረኩት የዛኔም አሁንም ከኮይዶ ጋር ነው scale up ለማድረግ apply ያደረኩትኝ እና that I won the grants. Koido is a civil society organization, like it's an NGO in Ethiopia, and we hope to like effectively address ከነሱ ጋር ነው project implement ይደረጋል ብለን የምናስበው ግን at the same time I think ground in these ማድረጉ is continuous communication and understanding of the context with the local stakeholders. ስለዚህ አሁን እኔ ፕሮጀክት ፕሮፖዛል ቡክ ዴቨሎፕ ማድረግ ነው ግን the activities አይደል አክቲቪቲዎች ይወጣሉ አይደል the activities is like having communication with like university students there having communication with like obstetrics and gynecologists and like working in Debre Marcos or like Addis Ababa ምናምን engaging like religious and community leaders is that just እንዴት ነው ይሄ context specific ነው ምናምን መጀመሪያ ላይ engaging them in like focus group discussions like what do you think is appropriate and then challenge their thought process ይሄኛውን ቢማሩ ምንድነው so contextualize የተደረገ ነገር produce ማድረግ ነው ፕላኑ የተጻፈው project proposal እንደዛ ነው ግን ያው it's community engagement it goes down to like community engagement you can't bring something that works with Jagger and then just አሁን ስራ ማለት is impossible Nah, like I think it really requires dialogue so now the project that I hope to implement as well is written in such a manner it has a lot of like Zoom sessions like in-person focus group discussions like content testing by the students and content testing and like by religious leaders that's how we hope to like incorporate it Ethiopia ውስጥ ያለው context ላይ
But በደንብ ነው explain ያደረግሽው this idea of identifying stakeholders and communicating the message across ስራሽ እንትን የሆነ አይነት ስሜት ይሰጠኛል ይሄ አዲስ አይነት የጤና ክብካቤ መድረክ የተፈጠረ ያለ ይመስላል ከጤና ጣቢያ ከሆስፒታል ይሄ ክሊኒክ የሚባለው ስትራክቸር ወጣ ብሎ ማህበረሰብ ውስጥ ያለ አይነት ኢንጌጅመንት እና ለሌሎች ሐኪሞችስ እንደዚህ ታያለሽ ሌሎች ቦታዎች ላይ ማለት አሁን ኢትዮጵያ ውስጥ ያለው የጤና ተደራሽነት እንዳንቺ አይነት ባሉ ሐኪሞች የራሳቸውን ፕሮጀክት መስራት በሚችሉ ሐኪሞች የሚመራ ይመስላል ወይም የሚደገፍ?
አዎ በደንብ እንጂ ልክ እንዳልኩ ያው ሁላችንም አንድ አይነት ስራ መስራት አይጠበቅብንም ያስባለሁ ግን ሁላችንም ባለንበት ቦታ በደንብ significantly contribute አድርገናል like everyone who's been assigned to and had been working in different parts of the Ethiopia have been contributing their own fair share to the reduction of the prevalence of certain illness ሊሆን ይችላል ብቻ በአጠቃላይ ለሜዲሲኑ ሁላችንም የራሳችንን fair share contribute እያደረግን ነበረ ከዛ አሁን በመጣው ብዙ ሐኪም አይመደብም but still ብዙ area of work improvement አለ at least ያሉት ሆስፒታሎች ነው ወይ ሳቹሬት አድርገዋል ወይ መንግስት ደሞዝ መክፈል ብዙ የቻለ ስላልሆነ እየተቀጠሩ አይደለም still ግን there's a need for it አይደል የጤና ጉዳያችን ሶልቭ ተደርጎ ሳይሆን ያው structure fit ስላላደረገ ነው so the more we go to the community with such projects you know ለኛም like we are targeting some part of the health and some part of the community while contributing for the overall improvement of health and like society growth in general so that's one way to look at it like necessarily clinical approach ብቻ ሳይሆን አንድ ሰው mental health ላይ ሲሰራ እዛ አካባቢ ላይ የሆነ improve እያደረገ ነው በአጠቃላይ ማህበረሰቡ ላይ ማለት ነው in addition to the clinical service that we provide at the clinics ቁጭ ብለን ከምናደርገው በላይ ያንንም እናደርጋለን እና እንዲያውም I feel like there's a lot more that needs to be done at the community level like a lot more right and then it's better prevention is always better than a cure so I think there is a lot of space for medical doctors to take their skills acquired from medical school and also working in the clinics more than like an individual level በደንብ ማህበረሰቡ ላይ የሚሰሩ ስራዎች አሉ እሰየው ነው መልካም ነው like ሁላችንም we're doing our best like then trying to reduce ailments and improve health which we are in the clinics and outside the clinics but there is a lot of work that could be done outside the clinics and in the community so there's a lot of potential there
yeah well so I think ወደ ማጠቃለያው ልግባ ከዚህም በፊት ከቤቴል ጋር የምናስበው ይሄን ነበረ ጁኒየር ዶክተር ነሽ ስለዚህ አውቶማቲካሊ የጄዲኤ እና ባለሽ እና ከሌሎች ኤክስፐርቶች ምናምን ከምንማር ኤክስፐርት ኢን ዘ ሜኪንግ ከሆኑ ሰዎች እንደ አንቺ አይነት ሰዎች እርስ በራሳችን መማር እንችላለን ብዬ አስባለሁ እና እንደዛ አይነት ፕላትፎርም ማዘጋጀት ብንችል እና እርስ በራሳችን መማር ብንችል እኔ የማውቃቸው ነገሮች ለአንቺ እና ሌሎች ለነቤቲ እና አንቺ ደግሞ ለእኛ አይነት ሰዎች እርስ በርስ መማማር የምንችልበት መድረክ ቢፈጠር እዛ ላይ ምን ያህል የመሳተፍ ፍቃደኝነትና ተነሳሽነት ይኖርሻል?
Of course, I'll be very, very happy to take part in that. That sounds like a good idea, like supporting one another. I think that's what we lack, outside support, kamedararak. And I think we will learn more from one another, more than we would from outside. So learning from each other's experiences, like from you, from Beta, and then you from me, you know, we just bring whatever we have independently. So I think it's a perfect thing and I'll be happy to take part in that.
እኔ ማወቅ የምፈልገው ሁሉ አውቄያለሁ ቤቴል ምንድን ነው ያንቺ ሀሳብ ተጨማሪ ጥያቄዎች አሉሽ?
I think ወደኋላ እንዳልመልስሽ ብዙ ነገር ዲስከስ ስላደረግን ግን እኔም ያው ፐርሰናል ኢንትረስት ስላለኝ ኢሳርኤችኤስ ነው በጣም ፕሮጀክትሽ ኢንስፓየር ያደረገኛል ፐርሰናሊ ሶ ኮንግራትስ ኦን ዘ ግራንት ኤንድ ስኬሊንግ ኢት አፕ አም ሹር ትልቅ ቦታ ይደርሳል ብዬ አስባለሁ ደግሞ አይ ሪሊ ላይክ ዛት ዩዝ ላይ እና አዶለሰንት like mindset መቀየር ከፈለግን we have to start from the bottom እና ከታች ጀምረን ኤዱኬት ማድረግ I think it can break the cycle እና like more aware የሆነ community build ማድረግ እንችላለን ብዬ አስባለሁ so like just like to commend you and like ፕሮጀክቱን ስታወሪ like rise up ነው support ያደረጋሽ ከዚህ እንደሌለው like fellowship አንድ ላይ fellowship በሚያልም ተሳትፈሻል እና they helped you in a way እዚህ stage ላይ ለመድረስ so in what way ነበረ ያገዙሽ how like ምን ያክል ነበር ኢምፓክቱ ላንቺ ለካሪርሽ እና like ሌላ ሜዲካል ፊልድ ያለ ሰው ስለነዚህ አይነት ፌሎሺፕ ብዙ ኢንፎርሜሽን ላይኖራቸው ይችላሉ ብዙ ሰው አፕላይ ሊያደርግ ይችላልና encourage ታደርጊያቸዋለሽ ወይ ነው
I guess from the first one እነዚህ ፕሮግራሞች ላይ engage ማድረጌ ራሴ ላይ I think ራሴ ላይ በደንብ more እንድተማመን ረድቶኛል my leadership potential and it's changed the way I see things. I think lack adarg የነበረው እኔ influential መሆን እንደምችል like also being recognized as a young leader yes you get to change something and you are able to የሚለው mentality ራሱ I feel like MSAUS to develop ያደረገ ነበረ ግን like being part of this like leadership programs actually really helped me and also acknowledge my impact ትንሽም ሊሆን ይችላል in a way it shaped the way I see leadership you know and it doesn't need to be on a magnanimous የሆነ ነገር መቀየር አይደለም you need to change yeah we all want to change the world but the world is the perception of everyone and then there was such thing in this it's we all make up our own world in our head and then if you could change the experience of somebody or the perception of that sense of world for one person then hey you're changing the world you're a leader already no I think in these programs ላይ መሳተፌ እንደዚህ like impacting life እንዳላይ እችላለሁ በደንብ እችላለሁ የሚለው mentality like gradually እየጨመረብኝ መጣ and also engaging with like other young leaders from across the globe and in different parts of Africa who are on the same journey as mine እና like እንደዚህ ነው የሚቻለው የሚለው and በራሴ ካፓሲቲ ሞር እንድተማመን ያደርገኝ መጥቷል ግን ከዛ በላይ ደግሞ አሁን ልክ ቅድም እንዳልኩሽ like project proposal writing grant writing monitoring and evaluation programs like and practice እንዴት ነው ማድረግ የሚቻለው ምናምን የሚባሉትን ነገሮች በደንብ experience ያገኘሁት ከነዚህ ፕሮግራሞች ነበረ like women deliver young leaders program the rise up youth champions initiative like እዛው SRHR ላይ focus ስለሆኑ ከዛ more leadership ላይ ሲመጣ ደግሞ ወንደላ ዋሽንግተን fellowship ያሊም then to some extent like helped me become a better version of myself but at the same time like highlighting my experience women deliver what they do is that like ምን አደረጋችሁ so we could highlight you not on our platforms which I think Mandela Washington Fellowship also does so that also helped me network with like important individuals important stakeholders network and that he highlights መደረጉ and ከዛ በኋላ ደግሞ within like utilizing those networks I was able to get to women deliver program ላይ ሆኜ I get to learn about Rise Up and then you know like I take the next chance and then I get to learn about something and now checking so you also get to increase your networks which is very 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 important so they have really helped me so other people who are looking to engage in such fields necessarily ያውኔ ያለባቸው ፕሮግራሞች ላይሆኑ ይችላሉ ቅድም ሱራፌልም ሲል ነበረ የተለያየ ኤሪያዎች አሉ NCDs live and I'm an emerging young leader I'm not very well versed with those but there could be something like that in your area of interest there is a lot out there like once you've pinned it down and narrowed it down and then there is a lot that could be done and it goes back to like investing time and energy and like allowing yourself to expand zan you should expand እንድታረጊ ለራስሽ ራስሽ ላይ ኢንቨስት ማድረግ ነው so yeah like apply to these things and then keep the networks that you have from this organizations from this training because they're going to get you somewhere networks are very important and then I guess it all like falls on to like investing your time and improving yourself in the area that you want to so there are a lot of like leaders program fellowship programs that would actually enhance and then build your capacity in that area. So I really highly recommend people to do that, for they would gain and much more.
Thank you. I think like perspectives of Australia as well. I think in a discussion follow research. And in terms of JD and Adam, I think we have a responsibility like እንዳሉ የማያውቁ ሰዎች ስላሉ እንደዚህ አይነት fellowship programs ሲኖሩ I think we'll share it to our networks እና ሳተፍ ኢንካሬጅ እናደርጋለን ያስባለሁ።
በጣም ነው እናመሰግነው ዶክተር ቤርሳቤ። አይ ቲንክ ያንቺን ስራና አስተሳሰብና ፊሎሶፊ በደንብ ሃይላይት ማድረግ እንችላለን ብዬ አስባለሁ።